Hello there, and welcome to Journey to Recovery. Our podcast focuses on the co-occurring disorders of mental health and substance abuse. We present a wide range of thought-provoking, hopeful, and positive topics from a clinical yet practical perspective, and provide a solid, truly integrated co-occurring disorder resource you can use in your treatment program or in your own recovery. Today we're talking about staying committed and motivated in long-term recovery. Our host is Dr. Hal Baumchen, a licensed clinical psychologist and licensed alcohol and drug counselor. He's the executive director of Northland Counseling Services and the clinical director of North Star Regional Co-occurring Disorder Treatment Programs. He's an author, speaker, and clinician with over 30 years of counseling experience. Hey guys.
Hey,
Morning, Gaylen.
We're here today with Gaylen Morse, our sound engineer, Tim Bode, our operations director at Northland. Nice to have both of you here. Always nice to be with you, Gaylen. Thanks for hosting us in your studio. We talked about doing some work in my office, so maybe someday that'll work out, and we'll bring Gaylen and his equipment into my office.
That
and
would
do
be
some
exciting.
Work there. Yeah.
Just remember, you'll have to clean your office as well as I've cleaned my studio.
Okay.
We're talking through some things about treatment, and I write treatment materials and work with guys in treatment, and I've run intensive outpatient treatment programs for men and women, and now currently in a residential treatment program for men. So we're talking through philosophy of care. What does it take for a treatment program to be successful, or the materials that I write? Why do I write them this way? So we're talking through a couple of things.
Yeah, so talking about what it takes for a program to be successful, I'm wondering what you think about what it takes for a person in the program, a particular person, to be successful.
Yeah, energized, motivated, committed, have some time, have an insurance program that allows them, maybe a family and friends that support their treatment. So, yeah, a number of factors would go into that. I think it's more than one thing. Mm-hmm. Willingness is part of it, but maybe there's got to be some other factors as well. Mm-hmm.
Overall attitude, it sounds like, is one of the real determining factors.
I'm a big believer in attitude is everything. So can you have a can-do, will-do attitude about treatment and about your recovery? So I am convincing myself that this time it's going to be different for me, and I'm going to stay at this long-term, and I'm going to do whatever it takes to get better, sustain long-term recovery, get my job back, my house back, my kids back, my loved ones back.
Yeah, and conversely, having a negative or defeated attitude can really sabotage your recovery and your progress in treatment. Right?
Negative attitude just drags people down, doesn't it? I mean, you see that in the grocery store and, where we work, and I know you're self-employed. Don't your employees kind of get you down sometimes?
One of them truly is a problem, but other than that.
And I try to keep my attitude upbeat and outgoing. I think a lot of people work at that, but it can be a beast to try to stay positive.
Your disposition then can actually encourage others or actually drag them down.
Sure. So you've been around somebody that is like a rotten apple in the barrel, and pretty soon the whole container is contaminated because of the poisonous disposition and attitude of one bad apple. So, yeah, you can build people up. That's the best when you watch that happen. But also you could drag somebody down.
Mm-hmm. And it's important to remember, for especially people in recovery, that you do have control over your own mood, your own disposition, and your own attitude.
Right, but I don't want control over that. I want to control you. So that's what people run into. Yeah, you don't have much control over other people or situations or circumstances, but in fact, you do have good control, or at least I want you to develop that, have control over your mood, your attitude, your disposition, your behavior. So why don't we exercise the control that we have? I told you this before, Tim, but I'm a Bible reader, and I read in the Bible, I was looking for control over, my loved ones, but I couldn't find kid control, I couldn't find pet control, I couldn't find spouse control, and the only control, I couldn't find employee control or employer control, I couldn't find any of that. The only control I could find was self-control.
Now, Dr. Hal, for those with co-occurring disorders, are there specialized interventions that are necessary because of that?
Right. I think chronic drug and alcohol use and even the mental health issues that come along with it can damage a person neurologically, or you could have some impairments secondary to the depression or the anxiety, secondary to substance abuse, and all of those things could make it more difficult for you to listen, concentrate, focus, and attend. And so specialized resources would, in fact, be very helpful.
Memory can be impaired, mental processing speed can be lowered, and that's got to make it harder for clients to get anything out of treatment, right?
Yeah, where you can't remember, you can't focus and concentrate. And well, are you calling your clients brain damaged here? Like, no, I'm trying to not say it that way, but there are cognitive deficits that can occur because of withdrawal effects, sleep deprivation, substance abuse withdrawal, depression, anxiety, bipolar illness, ADHD, post-traumatic stress disorder, and a minimal brain injury, all coming together can make it hard for the person to remember things. So we had to work at that to get people to listen to the material and understand it.
Right. So concrete and practical methods of processing material are required.
Right. So we got to make it easy for somebody to understand it, and then we've got to make it maybe get them to process it. So we use a lot of checklists and that kind of thing in the materials that I write, so that they don't have to generate all of the ideas themselves. We give them a list of ideas that they can use that help them focus on it, concentrate, attend to it a little longer, maybe stay with it, and get more out of it.
Mm-hmm. Another part of the philosophy of Journey to Recovery materials is to encourage people to embrace another chance.
I think go ahead.
So how common is it for people to go through more than one treatment program?
It's actually very common, and I just don't have the opportunity to work with people who are first-timers. I mean, it does happen, but usually I'm working with somebody who's been in treatment 3, 4, 5, 10 times, even up to 20 times. And I like that. I like that they're trying it again. Mm-hmm. Oh, sometimes they feel like they have to, or they're going to have to go back to jail or something. But I think sometimes I really want help. I made some sobriety last time. I'm really feeling like it could work for me. So, I think last time when we were talking, you mentioned trying to instill hope. So even if you're 5 times into this, 10 times into this, we want you to believe there's hope.
Basically, don't get mad at them.
Yeah, don't get mad at them for coming back again. And, you work in the field long enough, you get to know these guys. Here they are again. Don't get mad at them. Help them. Pull them up, encourage them, support them the best you can.
Mm-hmm. Develop some positive momentum. Mm-hmm.
Right. How do you do that? You all know what it's like when you have that negative momentum. You do something dumb. Then there's a consequence to what you did. Then you feel bad about what you did. Then you are in so much emotional pain, you drink or use drugs to try to escape the emotional pain. Then when you're drunk or high, you do something you regret. You do something dumb. Then you have strong feelings, and you're swirling down the toilet with negative attitude. Things aren't going your way. One calamity is bringing about more consequences, and you feel horrible about yourself. That's that negative scenario. We want to try to get positive momentum, positive motivation and momentum, where you're doing one thing right, you feel good about yourself. Because you feel good about yourself, you get around with good people, they encourage you, you feel better about yourself, you do something else right, and you have positive momentum going.
I'm sure working together in a group would help that positive momentum flow.
Right, because you can't do it for you can do it for yourself, but most people don't. So I can do it for you, and you can do it for Tim, and Tim can do it for me. That actually works pretty good.
It's also helpful in your recovery to give feedback and address concerns of others who are in a similar stage of the recovery, and that happens in a group setting.
Groups can be helpful in so many ways. you feel supported and understood and encouraged. You feel like you fit in, you belong, and you can get advice from somebody, some suggestions. They've been through it before. They got some ideas about what worked for them. And that can really be a powerful aspect and a powerful part of group therapy. Mm-hmm. Or a support group like AA can be very helpful that way as well.
Isn't it true that the treatment program is a safe place to get some of that support?
Yep, that's what we're looking for. So again, you feel like you fit in and you belong. And if you say something like, I got high and boosted a car, that you don't get laughed at. Somebody else says, yeah, I boosted one too and got in a lot of trouble. And we don't just share war stories, but we're trying to listen to each other, understand each other. So yeah, it's a safe place to talk through some difficulties, both with substance abuse and consequences, and also emotional trouble that people are in, like depression and anxiety.
And
go ahead, Tim.
I think it's not only an opportunity for you to get support yourself, but an opportunity for you to provide support, encouragement to others too.
Which is really good for them. It's really good when you help somebody else in the group. But I think it helps you to help somebody else, where you're feeling like you contributed to their recovery and you feel a boost of self-esteem. So it helps them and it helps you.
Mm-hmm. And in that group setting, isn't it good to allow yourself to receive those comments and guidance
from
those who've had similar experiences?
So I tell this story about working with a guy in a bakery where I worked after high school for a number of years, and his name was Smokey, and Smokey was from Latvia, and I don't even know where Latvia is, but he was from Latvia, and he said one day, I got to bring up a barrel of sugar to the guys upstairs in the bakery. And I said, go down to the second aisle, take a right, and it's the second bay on your left. Don't tell me, I know. So he wasn't a good...
That actually sounded more like a northern Indian accent.
I'm stuck on that one. Don't tell me, I know. Yeah, okay. Anyway, he wasn't a good receiver of advice or suggestions. Mm-hmm. And what makes a group go around is you can give some good advice and some suggestions, some help and encouragement, some good support, and you can receive it.
Another thing that we tell clients in the program is to get equipped for your recovery journey.
If you can find some tools that you can use, and then once you acquire those tools, start building skills to use those tools. So you're a woodworker, you know about this. Good tools, man. There's nothing like a good tool, the right tool. Then you need a little skill.
Right,
So,
and with the right tool, you can make great progress.
yeah, with a little bit of practice, the right skill, developing skill, and the right tool. So we try to write materials that really are tools to use, and then we try to train you to use them. So we're developing both tools and skills.
Speaking of all those things, you can find those things on our website. Go to AA meetings, get a sponsor, find podcasts, blog articles, things like that. And you can get books, find other people in recovery. All those things can be great options.
Yeah, and I like that you said, you can find most of that at journeytorecovery.com. I'm enthused about that. So I'm becoming a little bit more... I've got some ease or some security about saying, hey, you can find the best stuff on our site. And I think I was intimidated at first, but we're a number of weeks into this, so I'm going to start saying, like, hey, check our resources out.
Absolutely.
You've written a lot of great materials, things that include materials that include things like checklists, exercises, diagrams, process questions, all specifically designed to focus on a person's treatment needs.
Some of those tools and skills, really.
Right, exactly. And that's a lot of material. I'm not sure all those apply or fit to everyone. Is that right?
Right. So hopefully, like going through a library, what appeals to you? What could you use? What do you need? And you could select what you wanted. Mm-hmm. Or a friend of mine, Neil Anderson, he's written just 50, 60 books, but he said, I have no unpublished thoughts. And I'm starting to feel like everything I think, like, write it down.
Yeah, and I've also heard you talk about it as like being at a buffet table. So you don't have to take everything.
Great. So if you had a buffet table, then you would select the foods that you're comfortable with, what you want. When my daughters first started going to a buffet, with us as a family, I told my daughters they could have anything they wanted, and in fact, they could start with vanilla or chocolate pudding, and I wouldn't care. Anything you want, start in any order you want. And so buffet tables are fun, aren't they? And with our resources, lots of resources for recovery, like you mentioned, Tim, and you can choose what you want. And if you don't want it, don't take it, and then leave it for somebody who might like that.
Mm-hmm.
I knew a pretty great man who said, when you're feeding your cow, you throw the hay over the fence, and the cow eats the hay. And when the hay's gone, there'll be a pile of sticks laying there that were in the hay. His idea was, be at least as smart as that cow.
Yeah. Leave the sticks behind, eat what's nutritious and good for you, leave the rest that doesn't apply to you, you can't use. Or, you can't eat all the food in a buffet table. We wouldn't want you to do that. Leave something for the other guests. So, I think there's a lot of materials that we've written, Tim, that target specific illnesses or diagnoses such as anxiety. I write about stress and anxiety and burnout and worry. Hey, I don't have any of those. Well, do you have any depression? Yeah, I got a lot of depression. So use the resources that help you with depression. Leave the anxiety worksheets, checklists, that kind of thing for somebody who's maybe needing that. When you get some of our books, they'll have 40 lessons in, and not all of them would apply to you. And in every book, pretty much that I write, I try to write a chapter about the benefits of quitting smoking. Well, I don't smoke. Well, don't start, just finish the chapter. Yeah. Just leave it for somebody else.
All right. Well, thanks for listening to today's podcast. You can download materials that will help you develop skills to identify emotional problems, reduce symptoms, and prevent relapse at journeytorecovery.com. We've been visiting with Dr. Hal Baumchen, a licensed clinical psychologist and licensed alcohol and drug counselor. His expertise and clinical wisdom is now available at journeytorecovery.com. Share this resource with your peers and colleagues. See you next time, and remember, recovery is a journey. Enjoy the ride.